today I'm and I will be doing the oral care for the unconscious patient. So the purposes of this is first to remove the food particles from the around and between the teeth of the patient. Second is to remove the dental plaque. Third is to enhance the client feeling of well-being. Fourth is to prevent sores and infections of the oral. So the equipments that I will be using are towel, disposable gloves, curved basin, toothbrush, cup of tepid water, dentifrice, mouthwash, dental floss, at least two, and the floss holder. The first procedure is to explain to the client what we are going to do, why it's necessary, and how he can cooperate. So in this case, my patient is unconscious. So let's just, there's a concept that although the client is unconscious, we still have to talk to them as if they are conscious because there's a concept that they might still hear us. So, okay sir, I'm Ginger Valise. I'm going to be your nurse for today. I'm going to do the oral care for the unconscious patient. Okay, so I hope we can do it well. Okay, so next, after that, I'm going to wash my hands and provide privacy to my client. So I'm going to wash my hands first and close all the curtains, the windows, and the door. After washing my hands and closing all the windows, the doors, and the curtains, I will put my gloves. It's important because it will promote or provide proper sanitation and hygiene. Also the other one. So now I'm going to reposition my client into side-lying position to prevent asperity. Okay, Mr. Banyares, I will reposition na po. So I'm going to put his right arms over his body, then the right leg over the left. Then I will count 1 to 3 so that you can go forward. Okay, Mr. Banyares, 1, 2, 3. Okay, you can fix everything. Then I have here my suction apparatus ready with me. So this will serve as parang vacuum to get the water or the excess water into his mouth. So next, I'm going to put his towel under his chin to save the bed, the cotton, and his shirt. So I also have here the curved basin. I will put this under his chin. So after putting the towel, the curved basin under his chin, I have here his toothbrush. I will put a small amount of toothpaste. Then you can also use sponge and then swab to clean the teeth of the patient. Then I have here my padded tongue blade. This will help me to open my client's mouth since he is unconscious. Okay, now I'm going to brush his teeth. Then I will make sure to avoid injury to the gums. And also, if your patient wears denture, it is our responsibility to remove it, clean it, and replace it. Okay, I will brush his teeth now. I will open his mouth, then brush his teeth. Also the upper part. Okay, I'm done brushing his teeth. So now I'm going to use my suction apparatus. Okay, by the way, I used about 10 ml of water, or sometimes you can use alcohol. After doing that, I will wipe and use this towel to clean my client's mouth. Or you can use sometimes gauze. Then I will remove this basin. Careful not to spill the water. Then remove the towel. So now I'm going to put petroleum jelly to my client's lip to prevent drying and cracking of the lips. Just thin amount or little amount is enough. Okay, then after that, I'm going to reposition my client. First, I'm going to remove my gloves for proper sanitation. Then I will reposition my client. After doing all the process, I will reposition my client back on his comfortable position. Okay, Mr. Banyares, 1, 2, 3. Okay. After that, I will just fix my equipment and supplies. Then I will make sure that everything is clean. After that, I will also document my findings. So I made the oral care for my unconscious patient, Mr. Banyares. So far there's no bleeding or swelling gums or teeth.